Well, Dr. John Hovanesian is here from Harvard Eye Associates. Always good to see you, sir.
Nice to see you.
Welcome back.
It is a pleasure to be here.
You know, one quick thing, let's bring it up before we get into your topic. All of a sudden we go from all this kind of moist weather over the days, and now over the next 6 days, 7 days, we're getting dry weather, not necessarily hot, warm compared to how it's been, but we got the wind conditions out there. Maybe you could give us like a couple tips on that.
That's right. It is becoming high season for what we call ocular surface disease, which means dryness and allergy and anything that, just because the environment, now you got the dry wind, and if it blows in from the desert, it's particularly bad because it carries all the dust and all the mold that's been growing and all the pollen, which all leads to allergy, and that's what makes us miserable. So be prepared for it. If it itches, a good rule of thumb is if it's itchy, put cold on it, because that's probably allergy, cool compresses. If it's burny and not so itchy, try warm compresses. And of course, alternating or trying one, you're never going to hurt yourself by trying both. But,
that's a good point. You know, what you just said is so true. We've had months of rain, and so all this extra stuff has grown. And once we get in April and May, once this rain kind of goes away, it's just going to be...
It's going to be quite a summer.
Plethora of pollen.
It's going to be a sunny, warm summer with a lot of watered plants. We're going to see a lot of growth, and let's hope we all feel good. And let's get outside and enjoy that as well.
Yes. All right, we're talking about the subject today is laser cataract surgery. And I know we've kind of touched on this before, cataract surgery, laser surgery.
So there's a lot of confusion around this, isn't there? A lot of our patients have thought that we've always done cataract surgery with lasers, and for about 5 years it's been common, but it's not the most common way we do cataract surgery. So, of course, in cataract surgery, it's the most common procedure we do, especially for older folks. What we're treating is the front of the eye, the lens of the eye internally. That lens becomes cloudy, and when it does, the world's best glasses don't fix the problem. You've got to remove and replace the lens, and that's what cataract surgery does. So, the whole eye is shown there in our picture, but it's that front part of the eye where the lens is that we're replacing with cataract surgery. So in traditional surgery, we've gone in with instruments and broken up the lens. We use ultrasound to soften the lens and then to vacuum it out in tiny little pieces, and then we slip a new lens implant in the eye. Well, about 5 years ago, laser cataract surgery came along, and what a laser does in this case is takes the most precise steps of cataract surgery and automates them with the precision of a laser. So it makes the openings inside the eye that we otherwise make by hand. It softens the lens of the eye before we even touch the eye with instruments, so that when we go in, it's more like we're just extracting the lens rather than breaking it up, and so that we can then put a lens implant to an eye that's almost perfectly prepared to receive it.
Wow.
So it simplifies the surgery.
Now, is this used in all cases, or it just depends?
Well, there's cost in it that's not covered by insurance, unfortunately, and so not everybody chooses it or can afford it. And to be sure, we do really good cataract surgery with or without a laser. It's not required to do a good job, but it's about 50% of my patients who choose to have us use a laser to do the procedure. And it avoids some complications. It makes healing faster. It helps us to do a gentler surgery, less traumatic, and so it has a lot of benefits. But it's but there is a cost that comes with it.
Now, is the higher cost because it's still new, or is it one of those things like once the technology moves on, as we've seen, the cost goes way down?
Yeah, that's a great question, and it's partly because it's new. It's partly because the cost of actually doing the laser treatment are high, and they're not something Medicare covers. It's also because while we're using the laser to do those steps, it also can help to fine-tune the vision for distance, so that we can at least give a person the ability to see clear, far vision, so they can see road signs and see their television screen without glasses. So there's a couple of benefits to it. And we wish that it were covered by insurance. We'd like this to be available to everybody. We're not the ones who decide what it costs. We just want our patients to have access to the best technology that's available, and so we offer it and leave it up to patients.
Okay, let's ask the question that I'm thinking about, and I think probably a lot of other people. LASIK surgery cataract surgery, laser cataract surgery.
Right.
You got three things there that are
yeah,
all...
so what is that? That's a perfect question, because with LASIK, this is a procedure for people who have a clear lens inside their eye, in other words, who have not developed cataract, or people who've had prior cataract surgery can also undergo LASIK. So whether you've got a lens that was implanted or a young, healthy lens that God gave you, as long as it's clear, you can consider LASIK. And what LASIK does is in a completely different part of the eye. What we're doing is giving the person their glasses or their contact lens prescription directly on the surface of the eye, on the cornea. So the very front window there, the first thing that what you touch when you put a contact lens in is the cornea. It's the front clear part of the eye, and that is where we alter the shape by just removing microns, tiny bits of tissue, to alter the curvature and the focusing. So LASIK uses a different kind of laser than laser cataract surgery. LASIK gives you your contact lens prescription for those people whose problem really is that they'd rather not wear glasses, but don't have a cataract. Okay.
So when you're doing laser cataract surgery, are you also alternating the cornea if need be to do two things at once?
We are, and although it's not the same laser that we use in LASIK, it's a little different approach. We do alter the shape of the cornea to fine-tune its focus. We correct astigmatism, and between that and the choice of the lens implant that we put inside the eye, we can pretty well fine-tune things so that we have a very precise delivery of clearer vision. There's lots of advantages to this nice technology of using a laser instead of hand-performed cataract surgery.
Okay, another question. I always have lots of questions for you, and something we've mentioned before: those who may have had LASIK surgery in the past, and I know I think it was last year. My sister had cataract surgery. She was about fairly young, 50, 51,
that's young.
And she had LASIK surgery probably when she was like 33, 34.
Yeah.
So there were more complications for the other surgery because of the LASIK. Is that usually the case?
So this is a very common thing, because so many of our patients coming for cataract surgery have had prior LASIK or other procedures, and it does add an element of complexity to the planning of the procedure. It doesn't make the surgery itself harder to perform, but it makes it more uncertain how we measure the eye before surgery, so we know precisely what implant to put in. We have very good formulas for doing this and a lot of practice, but an eye that's had prior LASIK has more plus and minus, if you will, more uncertainty on exactly how it will heal after the procedure and how it will focus. So what we end up doing for many of those patients is cataract surgery, and sometimes we'll do a second procedure with LASIK. Even if they had LASIK before, they'll have cataract surgery, and they may need a touch-up with LASIK afterwards to fine-tune that vision if the implant was right, but then the eye healed and changed. Because of the LASIK, we can then adjust it again. So we have a way to solve the problem, but it does add a level of complexity.
Yeah, it took her, I think, a little bit longer because of that, everything came out fine. Now, is this what you're looking at?
Yeah. So in laser cataract surgery, the instrument measures the eye. So we don't have access to any of this kind of information when we do hand cataract surgery. The laser precisely maps the eye down to the level of the cell, and then we, the surgeon, can lay out the parameters for exactly how it's cutting, where it's cutting, how it's softening the lens, and that really, it's like if you had to draw a circle on a piece of paper, or you had a template to draw it around. I can draw a pretty good circle because I've had good practice with it, but I'm not nearly as precise as I am when I use a template to do it. So the laser gives us that kind of precision, and that does translate to a little better predictability of the visual outcome and a little better healing time and avoiding some complications. So it has some nice advantages relative to standard cataract surgery. But having said that, standard cataract surgery is still a terrific procedure that we do in many of our patients and have great results with.
Yeah, and I know that with the technology advances, things just get better and better, and one day hopefully this technique will be covered by insurance programs.
We'd love to see that happen, and we're even working our way toward treatments where we can prevent cataracts. Wouldn't it be nice if people didn't need surgery for cataracts? I'm not sure what I would do for a living, but I'll find something else, and I would love it if our patients didn't have to go through surgery to see better.
That would be something. Is that something they're working on?
It won't come soon, because developing cataracts is a little bit like our hair getting gray or our skin getting old, and we don't, it's a very complicated process, and we don't have a simple solution.
So you haven't made that infomercial yet.
Yes. I don't know about you, but I could use all of that.
But that, it's all good news, because it's just the advances are terrific, and when you folks at Harvard Eye and in other, just the whole area of Orange County and Southern California, we're very fortunate to have great advancement in eye care and technology.
I say it all the time. We're in the Silicon Valley of eye care here in Orange County. We're particularly lucky in my practice because we have the largest practice here in Orange County, and so we are leaders in helping our industry to bring better technology forward. So we do a lot of research studies that patients can choose to voluntarily participate in, and they get access to technology that a lot of doctors have never heard of, but are kind of common practice for us in our place. So.
All right, very good. Always good to always good to see you.
The words out of your mouth.
I know. And again, the wind's out there. Take care of yourself. And Harvard Eye Associates is located right down the road here, over by whatever that mall is going to be called.
Right across from Gate 2.
Gate 2.
Right? And right across from the flagpoles of Saddleback Hospital. From the front end.
Yeah, easy to get to.
Get your lubricant eye drops this week. It's going to be windy. You're going to need them for your sensitive eyes. So.
Yeah, we've already have felt it just in one day. So what a difference.
You can sense it.
Take care of yourself. Say hi to everyone over there, and we'll be right back.
Yeah.